I'm Dr. Mel Pohl. I'm the Chief Medical Officer at the Las Vegas Recovery Center, and I'd like to welcome you to this experience that you're beginning in the Pain Recovery Program. Our program is extremely unique, and I think you know that or you wouldn't have ended up here. So I'd like to tell you a little bit about what's in store for you. The first things that are most important are 5 key principles about chronic pain. Chronic pain, by the way, differentiated from acute pain. Acute pain, broken bone, surgical incision, infection in the tooth. The significance of acute pain is that it heals over time and the pain goes away. So it's a short-term experience. That's not what you're here to treat. Chronic pain is a process that really is unending and lifelong. It lasts longer than 6 months, and the key difference that most people have such a hard time understanding is that chronic pain is not the same as acute pain. And I say it's difficult to understand because, I mean, I have chronic back pain, which I'll mention occasionally. Well, my back pain hurts in my back. But it turns out that chronic pain is not about tissue damage. It's not about a bulging disc or an incision or an infection that won't heal. It's about the transmission of that signal, and it lodges in the brain. And the brain is really where chronic pain exists. So the first key principle in treating chronic pain is that all pain is real. I know that your pain is real. You're not making it up. You know, people might say you're exaggerating. You know, maybe your expression of what your pain experience is like is large, let's say. Some patients tell me they have a 15 out of a 10 pain level. Well, you can't have a 15 out of a 10 pain level, but you can have a 10 out of 10 pain. And the key here is that pain is a subjective experience. Only you experience your pain. There's nobody else who can judge or assess or value the amount of pain that you're in. Unfortunately, friends and family and physicians and counselors and therapists and psychologists talk to you about your pain, and they interpret your report of pain as unrealistic because they wouldn't experience it the same way. Their experience of pain is theirs. Your experience of pain is yours. And your treatment starts with an acknowledgement that what you tell me is going on in your body, what you tell us is happening in your joints or your tissues or your muscles, that's a real phenomenon for you. And we will listen to you carefully and we will validate that for you, because to not do that really interferes with the ability for me to help you. My best ability, our counseling staff and our nursing staff and our therapists, the best thing we can do for you is to connect with you, hear what you're saying, understand what you're saying, and provide a forum for you to discuss it with us and with other clients. The second issue that comes up that really is very challenging is this real pain or is this emotional pain? The confusion about where the pain exists. You know, people get accused almost of the pain is in your head, but the pain is in your head. The second key principle is that emotions and thoughts drive the experience of chronic pain. And that's what you're here to deal with, whether you like it or not. And until and unless someone deals with their thoughts about the pain and their feelings related to the pain, in my experience, they never get better. So our program is really built around helping people notice their thoughts. You know, we have sort of faulty thoughts. One of our faulty thoughts is, my back is killing me, my elbow is killing me, my feet are on fire. Those are really strong words, and they're not true. So the narrative or the story that we tell ourselves really interferes with our ability to get better. So we will help you see your thoughts and give you alternative ways to handle the thoughts that are really troubling you. And we will look at your emotional responses. What we found, by the way, scientifically, is that if we scan the brain of somebody like you who's had pain more than 6 months, it's an entirely different brain scan from somebody who's had short-term pain for an acute injury. So acute pain and chronic pain end up physiologically being different. And the place that chronic pain exists is in our brains. Well, what's happening in our brains? Our thoughts and our feelings. And the key feelings that I would say you're going to have to deal with are anxiety, anger, fear, and depression. And we have extensive amounts of resources and tools to help you manage and decrease the distress that you have in your life. Look, when you're anxious or you're angry, what happens to your pain? I'm certain that you, like everybody else who has chronic pain, the pain goes up when you are feeling these emotional responses. So we're going to help you deal with how you think about it and how you feel about it. And that's essential. It is essential for you to get better, for you to recover. The third key principle is that the opioids that so many of you have been taking as a potential solution for the pain have actually made your pain worse. There's two reasons for that. One is that when you take opioids on a regular basis, eventually they stop working. You've probably noticed that unless you increase the dose. That phenomenon is called tolerance. It's the body's response to being opiatized, if you will. The second is that if you're physically dependent on the opioid, and that happens inevitably if you are taking the drug on a regular basis, when you stop, you will have what's called withdrawal. You will feel worse. You will feel anxious and frustrated and more pain. Now, think about this. When you take a medication, let's say you're taking an opioid that is dosed every 6 hours, between that dose, especially as you develop tolerance, the drug wears off before 6 hours. So during that 4th and 5th hour, and you probably noticed this, your pain goes up during the withdrawal period. You take another dose, it goes down temporarily. The other phenomenon that you'll learn about while you're here is called opiate-induced hyperalgesia. Opiate-induced hyperalgesia means opioids cause more pain. They actually cause an inflammation in certain areas of the brain. They activate certain cells that are supposed to be quiet. They get activated, they secrete chemicals, and the chemicals cause an increase in pain levels. So the net effect is what you've either experienced or will experience is that as the opioids are taken away during the detoxification process, your pain levels will go down, and that decrease in pain will continue over the course of the next several weeks to months. The fourth principle about chronic pain is we focus here on how's your life. We ask you not what's the matter, but what matters to you, what's important. And it turns out that pain is much less important than if you are enjoying your life, if you are able to walk, if you are able to function, work, enjoy your family, hang out with your kids, grandkids, parents, boyfriends, girlfriends, enjoy things. So we are going to look at what's important to you with your assistance, and we are going to suggest that you focus on committing to function and making your life better. Taking the opioids away will help that. As pain levels go down, you will have more energy and more vigor and more wherewithal to do the things that you haven't been doing for so long. And we're going to help you focus on functioning better, because that's what's going to make you better. The fifth principle is that expectations influence outcome. One of the reasons I'm talking to you now is to help you see there are some pretty cool things ahead of you. If you expect the worst and you say, this guy is so full of crap and it can't possibly be because my opiates are the only thing that make me feel better, you're going to have a whole lot less fun in this program than if you really say, wow, I think that makes sense. I think I can do this. When we visualize positives, when we are optimistic, things go better. Does that make sense? I hope that it makes sense to you, because it's truth. I mean, we've studied this scientifically. Placebos work because we believe that they're going to work. So if you are able just take the leap, if you will, and believe that this is some place where you can be helped, where you can begin the process of changing your life. You will have a much better experience over the next weeks to months and have a better life. And that's really what we are committed to helping you do. So what are you going to see when you're here? What are you going to do when you're here? I'm sure you're wondering. We'll sit with you and we'll go over the schedule and orient you to all the activities and functions that you'll be experiencing. But essentially our program is divided into 4 areas. The physical is a huge part of chronic pain. Whether you have headaches or fibromyalgia or back disease or chronically broken bones or chronic infection, complex regional pain syndrome, the physical part of the experience is very important. And we have a robust physical intervention program. We have an acupuncturist who'll meet with you once a week, and a massage therapist, and a Reiki master, somebody who works with energy. We do yoga multiple days of the week, and we have a Qigong instructor, which is a movement breath coordination. After you're here for a little while, we'll send you over to physical therapy. In physical therapy, you'll receive a complete assessment and then a plan for you in their gym. They have a Pilates studio. I mean, they have multiple resources that can help you retrain your body. Typically, people who are in pain move less. And it turns out motion is lotion for your sore joints and your achy body. So getting moving is really key. We have a physical trainer who comes during the week who will help you get moving in addition to yoga and Qigong. And we also have a chiropractor. The other 3 parts of the puzzle, however, start with thoughts. So we will really, as I mentioned, train you, if you will, to think differently. And there's a lot of techniques. The therapy is called cognitive behavioral therapy, and there's a lot of research that supports the fact that CBT is the initials, works to help people modify their thoughts. So instead of the intensity and the hugeness of the distress and disaster, we can see that, yeah, you know, I mean, my back hurts. You know, not my back is killing me, and I want to, you know, I have to get out of this no matter what. The desperation can be modified when we work on developing different thought patterns. And of course you have to practice that in order to make those changes effective. We also have therapists who have expertise in dialectical behavioral therapy. They really teach people how to decrease their distress, so that the anxiety and the fear and the anger and the frustration that are so much a part of one's experience when you have chronic pain can be gradually diminished, and you can learn techniques to diminish the intensity of those emotions. The 4th part of the program is what we would refer to as spiritual. And the spiritual nature, and you know, let's characterize spirituality as totally different than religion. You know, we are not a religious program. Some people believe in God, some people have a religious basis, and we support that. But the spiritual nature of chronic pain treatment is, let's start with anything other than me. You know, this illness, this process consumes. It becomes everything. It becomes who I am. It becomes my identity. In the spiritual parts of the program, you will see that there is something other than you, and perhaps you've already experienced that, you know, whether it's a higher force or other people. Being in groups with other people may not feel very comfortable, but it's the best place for you to be, because you can get to identify with other people who've experienced what you have, and hopefully there'll be people here who've gone through some of what you've gone through already, and they can give you some of the optimistic viewpoint about what's to come. We'll teach you how to meditate, and a lot of people say, oh, I can't meditate, oh no, I can't quiet my mind. Meditation isn't about quieting the mind. Meditation is about noticing what's happening in your mind and developing patterns of redirecting your attention to the breath. There's a whole lot of different techniques. You'll have several different instructors who teach you. There's one particular meditation around the body called the body scan that reduces pain in the process of just noticing what's happening inside your body. So it's just a brief overview of what kinds of things to experience. Please, my sincere desire is for you to come with an open mind and allow yourself to believe that you can get better. I know that you can get better. I've seen countless people come in broken, disabled, depressed, distressed, hopeless. And you know, once the opioids go away and they begin this process of engaging in the pain recovery program, their lives transform. The shine comes back in their eyes. When your family comes, I've heard families say, oh my God, I haven't seen my husband or wife or kid or mom looking like this in decades. So give it a chance. I wish you so much well.